Argument that the Obama campaign makes, that the $716 billion is all in cuts to providers and insurance companies, and it will have no effect on benefits or services to the beneficiaries. Let me ask my question. Medicare's own actuary of Medicare, not of the Romney campaign, says that's impossible, that you can't have the same services for $716 billion less. And let's put up some of what the Medicare actuary says. They say that 15% of Medicare providers will be unprofitable by 2019. 25% of Medicare providers will be unprofitable by 2030. And the Medicare actuary concludes, this is his quote, "In practice, Medicare providers could not sustain continuing negative margins and absent legislative changes would have to withdraw from providing services to Medicare beneficiaries, merge with other provider groups, or shift substantial portions of Medicare costs to their non-Medicare, non-Medicaid providers." In other words, according to the actuary, Medicare patients, millions of them, will lose access to Medicare benefits.
If Medicare companies that are involved in the program continue doing what they're doing, which is inefficient. Let's take, for instance,
wait a minute. The actuary says, in practice, Medicare providers could not sustain continuing negative margins.
If Medicare providers continue to do what we're doing right now, under the old program, Chris, if a senior got readmitted over and over and over to the hospital for the same illness, they got paid every single time the senior got admitted into the hospital. Why not strengthen the benefit by adding preventive health care to it and trying to ensure that this patient gets accountable care and treated before they get that disease?
And if the providers don't do it, then what happens is, under your plan, this unelected board, 15 bureaucrats come in and they decide what. Well, you're laughing at it, but that is it.
I guess I'm laughing at your characterization of it.
Are they not an unelected? Are they an elected board?
They're medical professionals. They're people that we trust to make medical decisions.
Are they elected by anybody? They're an unaccountable, unelected board that comes in and will make decisions on what the providers and the hospitals have to do.
Because their decisions...
and Congress either has to vote it all up or all down.
Yeah. Well, look.